morning, Camerado. Welcome to CSMS News with your host, Blake Hunton. Today's topic will be on the disease sickle cell anemia. Sickle cell anemia is a disease in which red blood cells become irregularly formed and can block blood and oxygen flow to certain parts of the body. Low oxygen levels can cause fatal damage to tissues and organs. Today, our own reporter, Jacob Rose, will be having an interview with a sickle cell anemia patient. We now go to our reporter out on the field.
Thank you, Blake. Today here we have Evan Lefebvre, a sickle cell anemia patient as well as a dear friend of mine. So, Evan, when were you first diagnosed with this disease?
I was diagnosed when I was a newborn. My treatment, though, didn't begin until I was about 2 months old. The treatment stopped when I was about around 5.
What was the treatment plan for that period of time?
Treatment was a daily dose of penicillin. The penicillin helped prevent infections like pneumonia, a common infection that won't be too severe for a normal person, but could be life-threatening for someone with sickle cell anemia.
Has the disease ever been close to a form of a cure?
No, there's no form of a cure yet. Patients can still take antibiotics to help prevent pain. Patients also have the possibility of getting a bone marrow transplant.
I've heard this disease is most commonly found in eastern parts of the world. Is this true?
Yes, the disease is most commonly found in countries such as Africa, India, and Saudi Arabia. In the United States, it mostly affects blacks.
How have you been keeping yourself healthy?
I've been drinking plenty of water each day, about 8 glasses a day. I've also been taking a daily folic acid supplement, and I've been consisting on a diet of whole grains, fruits, and vegetables.
What are some complications you have with the disease?
I've only had vision problems and severe episodes of pain.
What are some things your doctor told you have to do while having the disease?
My doctor told me I have to avoid extreme temperatures, exercise regularly, don't overdo it, use the over-the-counter medications with caution, fly in pressurized air cabins on airplanes, and plan ahead when traveling to high-altitude areas.
So how do red blood cells differentiate from sickle blood cells?
Well, there are many differences such as shape and lifespan. Regular blood cells are roundly shaped, while sickle cells are shaped as crescent moons. Also, regular blood cells live for about 120 days, while sickle cells live for less than 20 days.
So what's so dangerous about sickle cells?
Sickle cells can get blocked during movement and can block the movement of red blood cells to the body. This can cause severe pain in the chest, abdomen, and in bones.
How long does the pain last?
The pain can last from a few minutes to a few hours.
Have you ever thought of a bone marrow transplant?
Yes, but finding a donor has been very difficult, as you need a sibling to donate. Also, the procedures may be deadly and may not help at all.
What effects do sickle cells have on the body?
The sickle cells can have effects such as acute chest syndrome, pulmonary hypertension, blindness, and skin ulcers.
Have you had any problems with ailments such as these?
Not yet, but as people with sickle cell anemia age, the risk for the problems become greater.
Have you had any trouble on airplanes? I've heard that unpressurized cabins can cause a sickle cell crisis.
Thankfully, I've not had any problems in airplanes, and yes, you're right, unpressurized cabins can trigger a sickle cell crisis, giving the patient severe pain.
What about education problems? Have you ever had to enroll in any special schools?
Fortunately, no. Although I've needed to watch out for things such as gym programs, temperature of the area of the school, and meals and served at the school. Sickle cell anemia hasn't affected the way I learned though.
Is avoiding harsh temperatures a good precaution as well?
Yes, it is very important because of the possibility of a sickle cell crisis. In California, here where I live, it never gets too hot or too cold.
Sickle cell anemia passed down from your relatives?
Yes, the disease is passed down from both my parents. The sickle cell gene is a recessive gene that is passed down from both your parents to get sickle cell anemia.
Is it important to get vaccinations?
Yes, vaccinations such as the flu shot can help a patient with sickle cell anemia, especially children with the disease.
When should you go to the doctor when you have sickle cell anemia?
You should go to the doctor when there are unexplained severe pains, swelling of the hands and feet, abdominal swelling, pale skin, and signs of a stroke.
What about like a regular checkup?
Yeah, doing those is good too.
Anything else you can tell us about sickle cell anemia?
No, I pretty much explained the most important parts of the disease.
Well, thank you for being on the show today, Evan.
It's a pleasure to be here, Jacob.
We now go to our newscaster, Blake Hunt.
Thank you, Jacob. That was a very interesting interview we had today. For a small recap, sickle cell anemia is a disease in which red blood cells become irregularly formed. Also, sickle cell anemia patients have a decrease in bone marrow, which creates healthy red blood cells. That concludes our news for today. This is Blake Hunton from Camerado Springs Middle School News, signing off.